Well, this week's Cardiology Countdown will start with satisfaction with life and the risk of coronary disease. An interesting study published in the European Heart Journal measured satisfaction and found that it was associated over the next 5 years with a lower risk of cardiovascular events. It's always nice to start with good news. Interestingly, they measured different domains and found that job satisfaction, family life satisfaction, sex life, and self-satisfaction were all the domains that were significantly associated with lower risk of cardiovascular events. So a nice way to start the week. At the number 2 spot, we have another interesting analysis from NHANES looking at salt intake as well as potassium, and a recently increasing debate on sodium restriction. They found in the NHANES study, and this looks at 12,000 representative people, so of the general population, and looks at outcomes for the next 12 years, I believe, and found that increased sodium intake was associated with about a 20% higher risk of all-cause mortality, whereas interestingly, increased potassium intake was associated with a 20% lower risk. And so they argue that these data support the notion of sodium restriction and encouragement of potassium intake. And so time to get the bananas and maybe tomato sauce, also good things for the summer. And at this week's number 1 spot is an analysis from the NCDR, from the cath-PCI registry, looking at the impact of the OAT trial. As you know, this was a study that randomized patients to look at whether opening an occluded artery post-MI would be beneficial. They found no benefit. And so they looked before, after publication of the OAT trial, then after change in the guidelines, and found absolutely no change in the rate of PCI for occluded arteries in the 900 or so cath-PCI hospitals doing PCI. And so this suggests to them that something more would be needed from the trial data in order to impact on practice. They do point out that ischemia is not well assessed in the cath-PCI registry, and that was an exclusion criteria within the trial, and so it's not a perfect way to assess the impact, but an interesting one where sometimes a trial is not enough. So with this week's Cardiology Countdown, I'm Chris Cannon.